Okay, it's 3:31 today, so let's start the NHS Sussex annual general meeting. So good afternoon, everybody, and a very warm welcome to you all. My name's Stephen Lightfoot. I'm the chair of the NHS Sussex board, and it's my pleasure today to lead today's annual general meeting. And what we want to do today is to very much reflect upon the last year. Then we'll formally present our annual report and accounts, then look forward to how we're delivering our 5-year plan on improving lives together. And then we want to take a good opportunity to allow the members of the public to ask as many questions as we can, and we'll answer as many of them as we can in the time we have available today. So if we could just have the first slide, please, that would be very helpful, and then we can move forward. So that's me, that's my name. So, as I said, very much keen to talk about the last year, formally present our report, and then obviously take the questions as well. I just need to make everyone aware that this is a virtual meeting and is being recorded. So if we just turn on to the next slide, please, that would be great. So in terms of the NHS Sussex board, what I'd like to do is just quickly give you a run through in terms of who everybody is. So as I said, my name's Stephen Lightfoot. I'm the chair of the board, and you'll be hearing very shortly from our chief executive, Adam Doyle. Now, our board's made up, in addition to the chair and chief executive, of 6 executive members, 6 independent non-executive members, and 6 partner members. So our 6 executive members include Alison Cannon, our chief nursing officer, Amy Galia, our chief integration and primary care officer, Claudia Griffith, our Chief Delivery and Strategy Officer, Hannah Hamilton, who you'll also be hearing from very shortly as our Chief Finance Officer, Dr. James Ramsey, our Chief Medical Officer, and Mark Smith, our Chief People Officer. So that's our executive team. In terms of the independent non-executive members, I'm pleased that we're joined today by Louise Ansari, the chair of what was our Population Outcomes Committee and is now our Finance and Outcomes Committee. Festina Bayo, who actually chairs our Remuneration Committee now and is a non-executive director. Monica Fletcher, our most recent recruit, non-executive director and a member of a number of our committees. Rahul Jaitley, chair of the Finance and Performance Committee, and now we'll be taking on People and Digital as well. Paul King, chair of our Audit and Risk Management Committee, and Susan Marshall, the chair of our Quality and Patient Experience Committee. And then we're also fortunate to have 6 partner members on our board as well, representing different sectors around the healthcare system that we operate in. So we've got Dr. Raghu Rajan, who's the GP partner member, Joe Chadwick-Bell, who's the NHS Trust partner member, Dr. James Padmore, the Mental Health partner member, Vince Clark, who's the Director of Children's Services in West Sussex, and actually he's representing Children's Services. We've got Mark Stanton, the Director of Adult Social Services from East Sussex County Council, representing obviously adult social care, and Caroline Vast, Director of Public Health in Brighton and Hove City Council, who's representing public health across Sussex. So as you can see there, we've got a real breadth and depth of experience to help us to manage and to ensure we can deliver the healthcare services across the Sussex area of West Sussex, East Sussex and Brighton and Hove. If we just move on to the next slide, please. Just to give you a very quick overview of some of the NHS Sussex Integrated Care Board responsibilities. And fundamentally, we're accountable for improving the health of the 1.7 million people living in the 3 statutory authorities of West Sussex, East Sussex and Brighton and Hove. Now, we're established on the 1st of July 2022, and we've got 4 core purposes. And it's all about improving population health outcomes, reducing the inherent health inequalities that exist within every system, but also in Sussex, enhancing value for money and productivity, and supporting social and economic growth in the communities that we serve. And I think specifically in terms of responsibilities, then the main responsibility for NHS Sussex is to agree the strategic priorities and the resource allocation for all the NHS organisations across Sussex. And that involves allocating some £4 billion worth of public money. We lead the design and the improvement of the Sussex health and care system. We also drive collaboration and integration as the strategic commissioners. So our role is to commission the services for our providers to then deliver. And also we work very closely with NHS England on the oversight and assurance of our providers. So there are multiple roles that the NHS Sussex Integrated Care Board has across our system. So if we just then move just quickly onto the Next slide. Then in terms of the minutes of our last AGM, we had our first and last AGM was on the 27th of September 2023. Because of the nature of the governance, then the minutes were approved by the NHS Sussex board on the 29th of November 2023, and they can be found on our website, and you can see the link there that will also be available on our website, as I said. So a formal part of what we need to do today is to note the previous minutes at the start of this meeting, which is the purpose of doing that. We'll follow the same process for this particular meeting. So we'll approve those minutes at the NHS Sussex board meeting on the 27th of November, and then we'll then publish them on the NHS Sussex website after that. And then finally, on the next slide, just before we start in terms of the presentations, just in terms of giving you some information about the format for this particular meeting. As I said at the beginning, this meeting is being recorded and then will be available on our website after the event. I would just ask everyone who's obviously, most of you will be familiar with these type of meetings, but please keep your microphones muted so everyone can hear the presenters. Please use the Q&A box at the top of your screen to ask any questions during the presentations. Although just be aware that other attendees will be able to see your name and any comments or questions you post. So please do be mindful and respectful when using the chat function. We'll obviously answer as many of the pre-submitted questions and questions asked during the meeting as possible in the available time. We're scheduled to finish at 5 o'clock, and hopefully we'll be able to finish around that time. And if we don't have the time to answer every question today, or some of the questions are very specific to individual cases, then actually we'll cover those separately. We'll publish all the questions and answers we can on our website after the meeting. But what our intention is to provide an answer to every question that is asked today. So that's really all I wanted to say by way of introduction. What I'd now like to do is to hand over to our Chief Executive, Adam Doyle, who'll be able to take us through our year in review for the period from the 1st of April 2023 to the 31st of March 2024. Adam, over to you.
Thank you, Stephen, and good afternoon, everyone. My name is Adam Doyle, and I'm the Chief Executive of NHS Sussex. Today, I'm going to provide an update of how 2023-24 felt, how the year went, what went well, and also the challenges that we had to respond to as an NHS organisation. It's important to say that there's only a small amount of information that I'll cover today, but a lot in our annual report, and I'd really encourage you to access that on our website. And I want to begin by thanking all the people who've joined us today. I've had a quick ability to look through the chat, and a number of people have joined us today who've been really supportive of our strategy and what we've done this year. How would I describe 23-24? Well, we started on the back of quite a challenging winter, and this had been increased and compounded really by a number of different periods of industrial action. And whilst we recognised that everybody has a right to take a view about where they are when it comes to pay and conditions in the NHS, we still had to respond to that. And we knew that our staff across health and care worked incredibly hard. But within that context, we had to also manage people waiting too long for treatment, and where we had to also focus on areas that we had to improve. Hannah Hamilton later will take you through. Hannah's our Chief Finance Officer, and she'll go through the significant financial challenge that we responded to, both driven by demand, inflation, and the industrial action. And more than 110 days were affected by the industrial action here. And I want to sort of recognise that has had an impact to people who are on this call today, directly for the services that they weren't able to access, but also to those who've worked in the NHS and across the wider care organisations that support us. So it has been a very, very challenging year. But we did start the year with that focus, but also with a focus about how we're going to respond to the wider health and care challenges. And together with health and care partners, we had just developed for the first time a 5-year integrated care strategy. We call it Improving Lives Together. And that sets out an ambition for how we wanted to improve care for our population. And in the first part of 23-24, we had to make that a reality. And we had to actually write a credible delivery plan, setting out areas of improvement for the immediate term. People had told us where they were waiting too long for certain parts of services. Transforming the longer term, where we wanted to see more care in the community, and the areas of improvement. And you can see those on screen. We worked across the year to deliver this, to address the areas we've heard from local people, from patients and local communities. I'm really pleased to see so many members from our districts and boroughs who've been part of helping us create our integrated care plans in each of those areas. So thank you for joining. Some progress has been made, but in other areas, we want to be honest, we haven't seen the improvement yet that we'd like to make. As I've said, in particular, we understand that during the year, too many people waited for care and treatment. People had challenges accessing primary care, and too many people had to stay in hospital when they were ready to safely go home or go to a different care setting. Fundamentally, we can't ignore the reality that some people's experiences were not where they would want them to be. We also need to recognise that even though we've delivered more healthcare activity in Sussex than ever before, and despite the hard work of many people on the front line and behind the scenes, there are areas that just weren't at the required standard. And in this work, as an integrated care board, we have the formal responsibility for oversight, to oversee how services are working and the care for our population and what the level of care they're experiencing. The report on page 37 of our annual report sets this out and explains where the services performed well against the NHS Sussex operating plan, our plan for the year, and also where we benchmark against national comparators, because we compare ourselves to the 41 other integrated care boards across the country. So where do we know that there is still improvement to be made? I've been really impressed at the end of last year and coming into this year, how we're starting to see people waiting less long in emergency departments across Sussex. But in the year that was, the national standard was 78% of people should be seen within 4 hours. We managed to achieve 68%. Our waiting list was one of the largest in the country. I'm really pleased that we are one of the fastest systems reducing that waiting list, but many people would still say they're waiting too long. And ways of responding to that were also to respond to increasing the amount of capacity in the community. And a number of our community diagnostic centres have been established, and they've really taken forward quite a significant journey and quite a significant amount of patients. We also know that people waited too long in hospital when they were ready to go home to a different care setting. And at the end of the year, we have people waiting well above the national average, longer than 21 days. And it's really clear to us, and our public board today talked about what are the plans to therefore improve people being discharged quicker from our acute hospitals, our mental health hospitals, and our community hospitals. We also know that there are areas for improvement needed in the care for people with severe and enduring mental illness, and we've still got significant work to do to make sure we've got people accessing primary care services. Now, in all of those areas, we have a recovery plan, and in all of those areas, we are seeing improvement. So I'm really confident that we can therefore get that piece right. However, it is important that we're clear today that we still need to take action to make sure we can respond to this. In these roles, it's often quite easy to also talk about what hasn't gone well. And when I was thinking what I would speak about today, I thought, do I go with the positive things first or the things that haven't gone well? I thought it was important to say, these are the things that we haven't got right. But every day in the NHS in Sussex, there are great things that happen. And it's important to reflect that there are areas that we are performing well at, both if you consider our local position and compare that against a national position across the country. And there are areas that we are the best in the country. There are areas that we are really improving. And in some of those, I want us to highlight how we're doing. So we've increased the number of GP appointments being offered to our population with more than 10 million offered over the year. That's 600,000 above what our plan was. For those who work in primary care, particularly in GP services, I want to thank you for the work you're doing. I know we have got a number of members of the dental community in our system. You've also responded and put much more capacity into the system. We know we've got more work to do in that, but thank you for what you've done. We've also increased wider support in primary care, including what pharmacies can provide directly. And this was well used when we switched on NHS 111 to pharmacies to roll that out. One of the important parts for our system is to ensure that if people are in distress or their medical conditions are deteriorating, how do we get an urgent community response around them to support the number of people being treated at home without going to hospital? And last year, those that were referred, we managed to get just under 85% of people being seen by our urgent community response team within 2 hours. And of those, 94% were kept in their own home. We need to expand that service further to make sure we can respond to a changing demography of our population, particularly in areas such as East Sussex, where we are seeing a significant growth in the very older age population. But that's an encouraging place to be. We've worked incredibly hard with our ambulance trust, so CCAM, and we have achieved for the first year since the pandemic our ability to respond to the category 2 calls on time in line with the expected standard. And they are people who are experiencing symptoms of a stroke or heart attack, and we're now making sure post-pandemic we're getting them seen on time and getting them to hospital. Whilst we recognise that we know people have waited too long, we have given a specific focus on cancer. And over the year, we've seen a dramatic reduction in the numbers of people waiting longer than 63 days for cancer treatment. We were also above the standard for the number of people receiving a dementia diagnosis rate at 63%. And there's also been a significant increase in the percentage of people with a learning disability or who are autistic who have also received an annual health check. And that's 76% of people having had a chance to have their health and care needs reviewed. So in reaching a close to this section, I think it's really important to acknowledge the change that we've had in our own organisation. So we've had to respond to the national ask to reduce the size of our organisation by 30%. I know many members of my team are watching this today, and this has been a difficult time for them individually and for their teams. But we have reshaped the organisation to focus on our core purpose. And despite these changes, I want to recognise how hard our people have worked. And also, alongside colleagues across the system, I want to pass on my personal thanks. So in summary of this section, there is still work to focus on. There are still things we're doing really, really well. We are making progress in the majority of areas. Many people will say we're not making progress fast enough. For those that know me know that I will also say that internally and externally, but it is important we recognise we couldn't do this without those that are delivering services today. So while we're on this call, there are people treating our loved ones in Sussex, and it's important we record our thanks for them. Our teams have also shared some of their highlights in the next short film. So Laura, I'll hand over to you to put the film on.
Some real steps regarding increasing the number of appointments to see GPs, and certainly a significant increase from pre-pandemic levels. And also a lot of those appointments have been face-to-face for patients as well. There's been quite a shift for quite a few practices, a lot of practices around making sure that the patient's seen by the right person. And this has included drawing in a lot of the allied health professionals such as Pharmacy First and physicians associates and other members of the general practice team to really make that access better for patients so that they're seen by the right person at the right time.
We piloted an alternative approach to urgent dental care for patients who did not have access to an NHS dentist. Over a 5-month period, we provided an additional 106 clinical sessions for 514 patients with the most complex urgent care needs. We know there is still further work to do to improve NHS dental access for people living in Sussex. We continue to collaborate with the dental profession and use patient insight to enhance and transform the way we deliver dental care.
Partnered with the British Red Cross to establish the High Intensity User Service in the Brighton area. This service supports patients with many needs. These patients will call for an ambulance or come into our emergency departments, sometimes multiple times a week. The British Red Cross work with 999 and our emergency department to identify and work with these patients. They work on resilience, self-confidence, look at the services that are available to these patients in the community and look at unblocking the reasons why they're not accessing them. In the last year alone, the British Red Cross worked with 65 patients. This doesn't sound like a huge number, but for the system saved hundreds of calls to 999 and hundreds of presentations into the emergency department. More importantly, it means that these patients are getting the right support in the right place at the right time.
It's great to reflect back and consider what the all-age continuing care teams have achieved across Sussex, serving some of our most complex patient groups and also ensuring that over 3,000 patients at the end of their lives receive the care that they need.
This is tremendous. I mean, I was so fortunate to get the appointment today. It was like, you know, like that. Straight in, it's a wonderful facility. It's really beautiful.
I had a conversation with a lovely nurse on the phone, and then I came today, and then I was put into a CT scan, which was 3 minutes. It was very quick, very painless. It's a free service, and I think it's very good.
Kind of embedding the culture of like that mental health is important in this school and kind of helping them to facilitate that and lead it themselves. This hopefully kind of equips young people as well for kind of future difficulties that they may face.
I have a diagnosis of autism, yes, and ADHD. Well, when I found out, I thought my life was going to be over. So now I'm pretty happy about it because I know that there's a lot of other people in the school that are like me.
Having a real focus on health inequalities and actually understanding where they exist. So that's been through looking at our data in a lot more detail, but also speaking with communities directly. I'm really pleased that in Sussex we yet again have increased the number of annual health checks that have been completed in primary care for people with a learning disability. This is a fantastic opportunity for those with a learning disability to come into primary care when they're not poorly and not unwell, but actually then to have the time and the opportunity to consider if they have any unmet health needs.
It's to make sure you've got a good bit of health.
Yeah.
And give you an MOT.
Yeah, that's right. We have a great relationship. Oh, and it all started with having a proper health review.
I can open up to her because we've got to know one another.
It is an interesting time, and over the last year we've been able to define our target operating model, and we're now looking to redefine ourselves as a strategic commissioner. And I look forward to now starting the work around implementing that.
We're an organisation of many great individuals, and we've come a very long way in the last 12 months.
Yes, and so proud to be working for NHS Sussex. 23-24, it's been a hugely challenging year, but with huge rewards, and I think where that's left me and where that's left the organisation is an absolute appetite and commitment to doing the very best we can for our local population moving forward.
Thanks, colleagues. So the areas highlighted are described more in our annual report, and you can read some of the examples of the services and the differences that they're making. But don't take that from our view, everything's working well and we're complacent. As I said at the start of this section, we absolutely recognise the areas where improvements are needed for people and for patients. But what I am assured about is that these are all areas within our strategy and there's a plan to address them. We recognise more work is needed and will work closely with our partners to make the changes and improvements that are needed. Now, as I said, the financial position was also a significant focus for us in 2023-24. And I'll now hand over to Hannah, who will give you an overview of the year from that perspective. Over to you, Hannah.
Thank you very much, Adam. Hello everyone, my name is Hannah Hamilton. I'm the Chief Finance Officer at NHS Sussex. So over the next couple of slides, I'll take you through a summary of the annual accounts and our financial position for last year, 2023-24. So in that time period, from the 1st of April 2023 to the 31st of March 2024, NHS Sussex continued to work closely with Sussex Health and Care system partners with the aim to ensure that the system remained within its financial envelope and that in line with the NHS financial regime, all organisations would achieve a break-even position. However, as Adam has alluded to, at month 10, the system forecast was changed to a deficit of 37.1 million. There was subsequent further industrial action after this, which impacted on the final system financial position, and that was a £38.6 million deficit. Within this system position, the final NHS Sussex ICB position was a deficit of £18.6 million. It's the impact of the industrial action that we faced and inflationary pressures, whereby inflation was higher than expected during that time within the system. That contributed to the system position, and in the ICB position, it was largely to do to the shortfall. It was largely due to the result of unfunded inflationary cost pressures in relation to prescribing and packages of care. NHS Sussex did, however, achieve the mental health investment standard by spending more than the required target uplift. The chart on your screen shows how the £4.08 billion expenditure was shared across the services that NHS Sussex commissioned in the year ending 31st of March 2024. So looking at this summary of what we spent your money on, you can see that the majority of our budget is spent on hospital care. And then the other services which we spend a large proportion of our money include primary care, so GP services, mental health services, which include services focused on identifying those who are struggling with mental health issues and preventing them going to crisis, and those who need urgent help. Also community services, and that allows people to be treated closer to their own homes, and prescribing, so it's all the medicines and treatments prescribed to people living in Sussex. On the next slide, we talk about the accounts. So the accounts for NHS Sussex have been formally audited and approved. The slides show that the ICB achieved an unqualified opinion on the financial statements, which gives a true and fair view of the financial position, and were properly prepared. However, the ICB did have a qualified regularity opinion as a result of ending the year in deficit, and as a result, the auditors were required to make a Section 30 referral report to the Secretary of State. No regulatory actions have been taken as a result of the referral, but it was required of our auditors. So it's a tricky financial position, and going forward it's important to share that, like other systems across the country, the financial challenge continues in its current year and will likely remain for years ahead. Working with our NHS partners across Sussex, we have developed together a system-wide financial plan that develops and demonstrates a route to break even financial position by next year, by 2025-26, and we are working with our partners across the system to look at all areas to ensure that we're working efficiently and effectively. This will continue as we work together to deliver the financial plan for this year, 2024-25, and into next year, 25-26. It really illustrates the scale of the significant financial challenges that we're facing as a system over the coming years, and we recognise that there'll be more decisions that must be taken before we return to speak with you for our AGM next year in 2025. I'll now hand back to Adam, who will share with you our forward plans and ambitions for Sussex Health and Care.
Thanks, Hannah, really helpful. So I've shared an overview of the year with regards to the here and now and the immediate areas of focus. But a really fundamental part of our system's integrated care strategy is looking forward. And we've heard from many people about wanting care closer to home and also about the changes that people want to improve their health outcomes and to tackle some of the health inequalities. Many people who've dialed into us today know Sussex really well, and we have got some really vibrant and exciting areas, also coupled with many health challenges. We've got huge areas of rurality, we've got significant coastal deprivation. That makes up a rich tapestry for how we respond to many of those challenges together. And we hope that our strategy that we've agreed across all partners in our system goes further to serve our population. At the heart of our strategy is about 16 integrated community teams, bringing health and care services, and most importantly, the patients who experience them together with healthcare professionals to therefore start to work on the specific needs of the community. I want to take this opportunity to thank particularly our voluntary and community sector colleagues, also our other community partners, particularly our local authorities and also our districts and boroughs, who have really helped us think through what is the right construct for that. So there'll be 16 teams across Sussex, 4 in Brighton and Hove, 5 in East Sussex, 7 in West Sussex. And work is underway with our partners to achieve this. We also want to make sure that each of those teams are able to be brought together to develop as a one workforce, but also to have a really robust digital solution, because what many people have told us is they now want to have more digital channels by how they access their health and care services. We can't deny that since writing our strategy, we've also had a change of government. And we've looked at what we've heard from the new government, but importantly, what we're focusing on and what we've heard through recent weeks through the Lord Darcy independent investigation into the NHS is that the shifts we want to do, bringing care to our community, digital solutions, and moving from treatment to prevention, we feel really confident that our strategy aligns with that. Why is that important? So we're not looking to rip it up and start again. For all partners that have been part of shaping that with us, I think what this gives us is the mandate to try to move faster and at greater pace to respond to it. In a moment, I'll share an overview of the progress that has happened today and how we'll be moving this forward. But first, let's stop and watch the story of Jen. So thank you, Jen, a local patient who had a fall, and how Jen experienced the benefits of health and care professionals working together. I want to particularly thank Jo Chadwick-Bell, our board member and chief executive of East Sussex Healthcare NHS Trust, for her support in showing the difference that integrated care can make.
Across Sussex, we are bringing health, social care and other related services together across communities to meet their local needs. These integrated community teams will be enabled by our other key priorities: development of our workforce and maximising the use of digital technology. We have been testing this new way of working in parts of Brighton and Hove, Crawley and Hastings, and will roll it out across 16 areas in Sussex in the coming months. Jen's story is an example of how personalised, integrated care can make a difference.
Future was not very bright. I was told that I wouldn't walk again. I wouldn't progress any further than I was. So I didn't expect to achieve anything much more from my life. And that was my whole approach to life from then on, until it was changed, of course.
During a difficult period in her life, Jen began to experience blackouts. She was left in a coma after falling and hitting her head. On waking, she was told she would never walk again. Despite her usually upbeat and sociable personality, Jen lost hope. She required support for all her personal care and rarely ventured from her care home room. Then Jen was given a lifeline with the Joint Community Rehabilitation Eastbourne, Seaford and Hailsham team, a team of occupational therapists, physiotherapists, nurses, podiatrists, falls practitioners and rehabilitation support workers that work in collaboration with adult social care. They learned about the real Jen, what her life was like before the accident and the importance of her family. Together they talked through her immediate goals to regain her mobility, wash and dress by herself, and the actions needed to get there. With their support, Jen regained mobility and found new possibilities, shopping with friends, swimming, and even visiting her daughter in the US. This is the story of her journey to independence.
So when I first spoke to her about her reason for referral, I had this very positive and upbeat lady on the end of the phone who's saying, actually, I've had this condition, I've had 2 years where I've been kind of off my feet. I feel that there's more that I can get out of life. I feel that my quality of life's been significantly impacted by this, and she was so keen to see change for herself.
First thing that Daniela asked me, what would be my goal? What would be my goal? And I just said, to walk again. That's what I would like to do. And so he said, right, well then we'll go away and we'll work at just what we feel we can do step by step, and we'll see how we go.
And it was a series of small goals along the way. And the very first goal was, how do we get Jen that much more independence and that much more dignity returned?
Made a difference to Jen to know that she was being treated as an individual with her own needs and her own requirements. Very, very important, that individuality. It boosts self-esteem, it boosts self-confidence.
I think historically there's always been this element of us going in and setting the goals and things like that, but this personalised care approach, taking it more from the point of view of the client, taking their wishes into it and being adaptive to what they want right from the beginning might not be what they hope to achieve a little bit further down the line. So it's listening to the client, involving them as much as possible. And every time we came to see her, she was like, well, I was just wondering if we can, just that little bit of freedom and getting her out and about. And actually then she can now access the wider community a little bit more easily as well, being able to go out and live her life.
Really, the biggest change for Jen was just going through the process of, this is going to be a reality, I'm going to walk again, which was absolutely amazing and wonderful to be part of.
Her goal is to now go out and see her daughter in America, and that goal I think is going to be a reality for her, whereas when we first came to see her, that would have been an absolute pipe dream for her. And Jen was fabulous. She really put her all into everything we gave her to do to help her achieve those goals.
I shall be going to America, fingers crossed, God willing, so I can now go on a plane. There's no reason why I can't go on a plane, so there's nothing to stop me from doing this journey to New York. I think my daughters cried so much with joy, haven't they? It's just been wonderful, it really has.
So we have a clear ambition, and when you see people like Jen, or I get the privilege to visit many services in Sussex, it kind of reminds you why we do everything together, and when we get it right, how that can be right for people, but also where there's more work to be done. In 23-24, 3 integrated community team frontrunners were identified, one in Crawley, one in Hastings, and one in East Brighton. And partners have worked together with their communities to do some different things in each of those areas. So in Brighton, significant support for those who use emergency services more than most, and whether a different approach could have met their needs. And we've covered that on page 30 of the annual report. In Crawley, we focused on same-day access. The Crawley residents had said that they needed to have same-day access, but often when they had a number of other healthcare needs, how could they get continuity of process of care in that process? And 5 out of the 12 practices in Crawley, I know one of the practice managers on our call, they've really come together to respond to that really well. And in Hastings, we did quite a different approach, really, working with our community and voluntary organisations. Now, I know there's also colleagues from Hastings on here today. What a vibrant community that Hastings is. And we've learned a heck of a lot working with those organisations to therefore respond to the needs of the local population. And we can't make this happen without looking how we develop the workforce across all of Sussex. And it's really important that when we're looking at the current ways of working, we've got to have an eye onto the future. And we've developed our Sussex Health and Care People Plan. But there's been some tangible benefits of that. So I want to thank Sussex Partnership Foundation Trust. They're our mental health trust, and they also respond to people with learning disability and autism too. But they've worked with the University of Brighton, where students have a guaranteed offer of NHS employment when they graduate. So we're trying to look at every opportunity we can see to try and get people to be trained in Sussex, stay in Sussex, live in Sussex, to therefore create a workforce for the future. And I mentioned digital technology earlier, and it's really important. A lot of people tell us that they want to use digital methods. It's also really important. In Sussex, there are a few myths to dispel. All age ranges tell us that they would like to be able to access their health and care in a much more digitised way. And we're one of the highest systems in the country, with 59% of people in Sussex are registered on the NHS app. And each month, just over 7,000 appointments are booked or cancelled through the app. Now, we want to see that really ramp up to quite a significant degree, because in doing it that way, we can release our staffing resource to be focusing on seeing our patients, but also that tends to be giving our communities a better experience. I know it's not for everybody, and we've got to make sure that where people don't want to use those methods, there's different routes, but it is definitely a thing we have to focus on this year to really start to improve that. And looking forward, I've covered the recovery plans we've got in place for the immediate priorities, but we want to also make sure that we're being honest about there is a financial challenge as we go forward. And whilst there may be in the budget some money for the NHS, I can't determine what the outcome of that will be till we'll find out together. But in reality, the growth of our population, the age profile of our population, and also the multi-conditions that our population have now got, will mean that actually we're going to have to work very differently. So we do think the 16 teams is the answer, where we improve on population health, reduce health inequalities, and make sure that we are getting things as productive as possible. But we also need to lead a clinical and financial transformation of the NHS in Sussex over the next 5 years. And that will require us looking at where services should be best placed, what the best models of care are. Let's compare where our outcomes aren't what we want them to be. Let's ask ourselves why. And we know the current services are not sustainable in their current form, and change will be needed. But we want to do that in a way that gets more care into the community, closer to communities, and we need a planned and managed way to support this, working with our communities, with our partners, with our service users. This is going to take work and won't be easy, but what I've been struck by, every public sector leader that I speak to and their teams and the communities are pretty aligned. Most people want to be seen quickly close to where they live. Some people tell us they want to be seen by the same person. Many people say they want to be seen quickly. But the common piece people tell us is they want to get care at a time that meets their needs. So this will require us to think about, how do our workforce work now? What do they need to do differently? And also, how do we ensure that we're building a change with all of the public, with our communities together? So in closing this section of the meeting, and we're really keen to get into your questions for us, I want to reiterate Stephen's sincere thanks earlier for recognising the hard work and commitment that everybody in NHS Sussex. We have a responsibility to lead and manage an organisation. But alongside them, as I mentioned, there are 43,000 staff who work in the NHS in Sussex, which doesn't only include doctors, nurses, pharmacists, but there are many other roles that keep our NHS going. So thank you to our cleaners. Thank you to those who pick up the phone. Thank you for those who greet people as they walk into our healthcare facilities. Thank you to our hardworking practice managers. Thank you to our dentists that have chosen to keep seeing NHS patients. Without you, we couldn't do the work that we try to do. And we know that you're all trying to support the work of people and our communities, and we thank you for it. And finally, I want to also thank the wider leadership team across the public sector. Many people have supported the NHS over the last year in helping us consider the change you've got to make. And that is across the wide spectrum of education, police, fire. We've worked really closely with the local government partners, so thank you for your support. At times we have different perspectives, but what I've been really encouraged by is this is felt of a year where the public sector has come together to help to respond to a number of challenges together. There are also other smaller organisations that we don't always talk about. So thank you to the really small, but really pivotal VCSE organisations that operate for a really small population segment. We know we've got more work to do with you, but I think it's really important that as an NHS, we recognise that we can't do this on our own. We don't always have the right answers, but we are committed to working with people and our population to do the best. So I thank you all for listening. I'll now hand back to Stephen and we can then get into the questions. So Stephen, back to you.
Thank you very much, Adam, and thank you, Hannah, as well for your presentations, and also everyone that was in the videos. So I think we could take the slide deck down now, if that's okay, and go to a full screen show. At the core of our work is always to listen to the people that we serve. And so one of the things we wanted to do is to spend half-hour session today in terms of answering questions and answers from members of the public and interested people who've joined us today. I know the team have been working in the background and have answered some of the questions on the Q&A. So anyone who would like to raise a question, please put up your hand and then we'll endeavour to put you on the screen and allow you to ask your question live, and I'll direct that to individual members of the board, because I think this is part of the dialogue that's going to be important as we build an NHS that's fit for the future here in Sussex. Now, just while you're thinking of some particular questions, there's maybe just a couple of other thoughts I'd just like to add. And it's really clear at the moment that the NHS is a hot topic when it comes to not only our new government, but also the media. And there's acres and acres of coverage from many people who want to talk about the NHS. Adam mentioned the Lord Darcy report, and it's quite clear that we do recognise some of the key themes that were in that independent investigation of the NHS. We recognise that not all of our services are able to meet all the demand that is placed on them, and I think we understand that. I think what gives me confidence and what gives me optimism about the future is the fact that we do have a plan, and our plan that we've been developing over the last 2 years, Improving Lives Together, is very much focused on improving and creating the story of Jen, creating and enabling care at or close to home, because we know that's really where people want to be, to minimise the time in hospital. That will also help us to reduce the waiting lists. It will help us to improve access in some of the other services. We know we can't do that without our workforce. And so hence that's why the relationship with our universities is so pivotal in terms of that as well. And of course, digital and technology is definitely one of the solutions. But obviously, there's still a proportion of our population that absolutely still want to be treated as individuals through traditional means, and we want to cater for that too. But the fact that we have a plan is what gives me confidence, and actually the commitment of our partners, both in sort of health, in social care, across public health, and also the VCSE segment is really vitally important. So I think that we have a plan, we're actually working our way through it, and we're seeing some improvement. So I think it's don't believe everything that you hear in the news. There are still every day hundreds of thousands of really good interactions across our system here in Sussex. So I'm not seeing anybody raising their hands on my screen. Is that the case, Laura? We're not. There's no one raised their hand yet. Luckily, we do have one or two questions because we have also been continuing to engage. We've got a strong record of public engagement here in NHS Sussex. And so, we've got a number of different stakeholder groups and also engagement groups that we do engage with. So we took the opportunity to ask, some of those groups what was important to them. And the first question, and just to give Amy a clue, I'll be coming to you first, Amy, if that's okay. One of the questions we're often asked is, how are you improving dental access? So I wonder if Amy Gallier, our sort of Chief Integration and Primary Care Officer, you'd maybe like to be able to give some little further information on that. Amy.
Thank you for the question, Stephen, and hello everyone. My name is Amy Garland. I'm the Chief Integration and Primary Care Officer for NHS Sussex. So dental access is an area of challenge we know across Sussex in terms of access. And when we became an ICB 2 years ago, we took on delegated commissioning responsibility for this area from NHS England. It's important to say that I think we've spent quite a lot of the past 2 years myth busting some of the ideas that exist around NHS dentistry, specifically, for example, that unlike GP practices, you do not need to be registered to a dentist, and anyone can go wherever an NHS dental appointment is available across Sussex. And that was a really important point to start with. We do every year spend over £109 million on NHS dental services, and that is across a number of different contracts. Currently, not all dental providers do perform and deliver their full contractual value, and that is why we are seeing some of the challenges that we are in relation to dental access. But very early on in our life as an ICB, we sat down with dental providers across Sussex and tried to understand what some of the challenges are in relation to that contract. Some of it relates to workforce, some of it relates to remuneration around that contract. And we've been trying different approaches for how we best use the capacity that we have got available across our NHS dental providers. And I must say that this year we are on trajectory to deliver 80% of the contracted activity across the whole of Sussex. And that was the target we set ourselves, which is a 3% improvement from where we were at this time last year.
Excellent. Thank you very much, Amy, for that. I have another question, so just to give a heads up, for Stina, I'll come to you with this one in a moment. We had a question from Sasha Brown that says, how do you see the relationship between NHS Sussex and community groups and charities, both big, small and tiny, working over the next few years? So I know that Christina, you've got a number of experiences of this working in the communities, and I just wondered if you had a view of how we can strengthen our relationship with the VCSE segment.
Thank you, Chair. Thank you, Sasha, for the question. Yes, we are very keen in.
That's okay, we can hear you.
We are very keen in working with them and engaging with the VCSE sector because we realize and understand the valuable contribution that they make in terms of supporting with service delivery to the various groups and organizations, and the trust and relationships they built with those groups and organizations delivering those initiatives within the communities. We've been engaging with them, and there are ways and measures in place where we actively want to engage and encourage and work with them to ensure that we continue to engage with the communities and ensure that we use their data, their information, their insights to make the decisions that would be useful and beneficial to our populations across Sussex. But we are keen and we welcome more suggestions and welcome ways that we can work very well with the VCSE sector to improve the health and well-being of our communities.
Great. Thank you, Festina. I appreciate that. And actually, one of the initiatives that we've actually funded from NHS Sussex is the creation of a VCSE alliance, because there's something like 10,000 different VCSE organisations, that's voluntary, community and social enterprise organisations across Sussex. And actually, in terms of our Sussex Health and Care Assembly, we've got representatives on that. You know, we've got a number of other groups as well. So really, really pleased to actually have the opportunity to work with our voluntary sector. They really do provide a vital role and provide important services in some areas too. I'm also pleased to see there's been a few people that are brave enough to put their hands up. So why don't we just cover those questions? I've got a few more pre-submitted ones which we can come back to in a moment. But Chris, I think you're top of the list. Would you like to ask your question, and we'll see how we can help you? Is that Chris Mace? Okay, maybe Chris can't hear us, but okay, why don't we go to Ayad?
Yeah, good afternoon. Thank you. We hear the term integrated care, and to me it means health and social care. And as a trustee of Crawley Community Action, we have a project, social prescribing project, where the social prescribers have been doing excellent work for having care and support plans for their clients that covers all aspects of the person's social and healthcare needs. Now, in this whole, please don't take this as a negative, but in this whole meeting, I haven't heard anything about work between health. It was all about health, which is excellent, and social care. And this has been talked about in lots of meetings. Eventually, a person would have a health and care support plan where both sides or both aspects are taken care of.
Yeah. So I think that's a very good question. In fact, Ayad, and certainly we do work very closely with the three upper tier local authorities: West Sussex County Council, East Sussex County Council, and Brighton and Hove City Council. We have members of each of those councils on our board. So you know, in that sense, we're very well connected. We talked in our board today actually around discharge, and actually that's a classic example where we need to work really closely with social care, but also children's services too, and also public health. So it's not just about social care, but I think social prescribing is also a really valuable opportunity, and a number of our practices do actually work with that. And maybe I could bring Monica Fletcher in, one of our NEDs who's got experience in primary care, and maybe just to share a few thoughts around the importance of social prescribing in addition to the clinical prescribing that goes along, because actually in primary care both of those are really important. Mon, have you got a view on that?
Oh yes, Steve. Thank you. We have an echo. Yes, Steve, and thank you for that question and for a prime example of where it's working really well. Social prescribing in primary care is such an important thing, and I think so many people are used to prescribing as in medical prescribing, but actually, as you're well aware, there are many practices now that are engaged in these schemes. We can't just tackle things with medical solutions, we have to tackle them with other social solutions as well, but also things such as good exercise, food, etc., and joining the community up. And I think my colleague Festina just spoke very well about how we join communities up. So as part of NHS Sussex, our bigger plan is actually how do we help facilitate joining communities up to help individuals and communities like you've just described. So yes, you will see a lot more of this, but thank you so much for sharing such a really good example where it's working well. Yeah.
And in fact, actually, we hold our board meetings around different parts of Sussex. And in January, we had our board meeting in Crawley, in the town hall. And I actually visited, along with Hannah and a few of the other board directors, one of the GP practices. And they talked really positively about the importance of social prescribing. And they'd actually employed the social prescribers in their practice. So this is something that we do encourage. But today's meeting is in some ways about the NHS, because it's our annual meeting on the NHS financial report and accounts. But I can assure you we're absolutely talking to our local authorities, and our integrated community teams that Adam was talking about are going to be based around the local authority footprints of the lower tier authorities. So that's the district and the borough councils in particular. So I think Crawley Borough Council, I saw Ian Duke, the chief executive of Crawley Borough Council just a couple of months ago. There's a strong desire to work closely with local authorities. So that would be how I would do. But thank you for your question, I'd really appreciate it. Chris, could we maybe go back to you if you can hear us now? Chris, are you receiving? No? Okay, I'll come back to you again later, but I do have a Councillor Ballard.
Hello, thank you. Thank you very much for a very positive presentation. I just wanted to ask you a bit more about digital integration between hospitals and primary care and between doctors. I understand there are 3 different systems that doctors need to use within one hospital. Surely integration digitally that way will be an advantage. And I just wondered if there was any information you could give me as to how that would be progressing, because it's not really something that you've tackled.
Yeah, not specifically, but it's obviously absolutely vital as part of that. And I'll maybe bring Amy Gallia back in as our chief officer responsible for the digital and data agenda that we're working through. So Amy, would you be able to again just provide some further context in terms of what we're doing around the integration of digital systems, because that is vital to our future success and a key part of our strategy.
Absolutely, and thank you for the question, Councillor Ballard. You hit the nail on the head. To truly integrate services, we need connected information across different healthcare providers, and I think we would all recognise that if we were to start from scratch in the NHS, we wouldn't be in the position we currently are in. You're right, there are currently different systems across our different organisations, be they general practices or hospital trusts. But we have done work to connect those systems and to make sure that for clinicians who are providing care, there is at least a summary, what we call a summary care record, that supports people to make clinical decisions about someone's care, regardless of which setting they are operating in. We're now taking that work one step further, where we are connecting the patient record so that it is seamless across the different organisations, not just for clinicians who are giving care, but also for individuals via the NHS app, for everyone to have information about their healthcare. So it is a work in progress, but we are actively working in this space.
Right. So it's a really vital part of our strategy, and so we were talking about what we've achieved in the last year, but it's very much a feature of our plans in the Improving Lives Together strategy. So there'll be more to come, but it unfortunately takes time with very complex systems, but we're very clear that it's an important priority. Thank you for your question. Chris, can we come back to you again and just try and see if you are receiving this time?
Hello, can you hear me?
I can hear you, Chris. Thank you for joining.
Brilliant. My IT skills are not quite comparable to yours.
Well, I wouldn't say that, but Chris, we can see and hear you, so that's perfect.
Oh, wonderful, wonderful.
What's your question, Chris?
I'm chair of the Uckfield Friends, the League of Friends at Uckfield Hospital. I wonder where the community hospitals fit in with your overall strategy. We feel that the community hospital, particularly in our town, provide a fantastic service to the local population, but we're worried about the long-going future of the community hospitals and the functions that they will perform. As we've discussed with you recently, we've got major concerns about our hospital, and you haven't said anything at all in your presentation about the community hospitals, and I wondered where they fit into your long-term strategy. Thank you.
Chris, thank you for the question, Chris. I'll ask Claudia to comment in a moment, actually, if that's okay. But we met at the EST AGM a few weeks ago, didn't we? I think. So,
yeah, we did. Yes,
exactly. And so absolutely, you know, I want to assure you that community hospitals do absolutely feature as part of our plan. You know, obviously in a short presentation, we wanted to give you an overview, but this is the opportunity now. So Claudia, would you maybe just to provide a little more detail of the importance of community hospitals in addition to our major acute centres?
Absolutely. Thank you very much, Stephen, and thank you for the question, Chris. So as we've described earlier in the presentation, the shift of activity from acute into community and the development of the integrated community teams is a really pivotal part of our strategy and puts us very sort of congruent with the national direction of travel from the new government. So there is absolutely a real focus on what resources need to be provided across each of our 16 neighbourhoods that we've defined as part of that strategy. So the work that needs to be done now is really trying to define exactly what the needs are of each of those populations and how those are both best met, both through existing infrastructure or through any changes that might be required to best deliver that going forward. So there's a very active conversation about what that needs to look like for every single one of the 16. We need to look at the assets that are currently in place across each of those footprints and then look at how we get that sort of optimal use of resource for each of those populations. But there is, I just want to assure you, a really significant focus on exactly what care needs to be provided in the community, and that's absolutely critical for us.
Thank you for that, Claudia. Your camera's not on, by the way, but don't worry about that. So yeah, Chris, I think the other thing I would just add to that is that as we talked about just briefly at the AGM, so yeah, some of the services we offer out of Uckfield may change, and I think that actually is about how we can make the best use of that brilliant asset, because it's, you know, compared to some of our community hospitals, it's definitely not one of the older ones, and so I think we want to make sure we've got, you know, make that a vibrant community hub in the area that it serves, and so I see, you know, so I think that's something we'll come back to. So I think it won't necessarily stay exactly the same, but I think we'll need to make the best use of the resources that we have, and that's an important asset in that particular community.
Okay.
So thank you.
Yeah,
thank you for that, Chris.
Thank you.
Tracy, can I come to you now, if that's okay?
And yeah, it's Councillor Bangett, Tracy Bangett. Yeah. So how do you foresee the use of AI in the future of the NHS, particularly in diagnostics, for example?
Oh, well, that's a really good question. And we happen to have a real expert on our board, which is Monica Fletcher, who you've already heard. So Monica, I didn't think you were going to get so many questions today, but AI in healthcare. Come on, you're the expert in this area and you do a lot of research in this area.
That's a brilliant question, Tracy. And just to say, we are in early days. Just outside of my work with NHS Sussex, I am involved in 8 big national projects looking at AI in multiple long-term conditions, and this is sort of predicting who's most at risk. It's looking at multiple prescribing, it's looking at all sorts of aspects. I also work with the Turing Institute, who are leading on obviously in AI and many other fields. It's fair to say the health service has been slow to adopt AI, but I think actually now we're moving forward at a really rapid pace. I think you've opened up a fantastic question there, that we need to engage the public and have the public involved in anything that we do when we talk about AI in healthcare, because I think there might be some concerns about what that means. But as far as I'm concerned, it's using data in a different way, by using machine learning, by sort of predicting, by helping us to look at hotspots, help us to look at areas that we need to concentrate on. So we're on a very early stage of a digital and data trajectory, as you've heard earlier on, but actually what we can do to actually accelerate some of the things in the community is fantastic. My colleagues in hospitals will be telling you that actually now we can do diagnostics much quicker, and you know, I can only see more and more benefits happening in the health service, and it is in alignment with obviously the new strategy with the NHS that this is coming our way. So early stages yet, but fantastic question, Tracy. I'd love to pick up with you outside of here, or anybody who wants to pick up with me. So thank you very much.
Happy to do that. Thank you very much.
Yeah, that's great. We have as I said, we have a real expert when it comes to that. But I think we also need to balance that against how much we can invest and when. So I think what we'll need is proven technologies to be able to, before we can go to adoption, because we also need to make sure we use our limited capital to actually also make sure our estate is fit for purpose, equipment is updated, scanners are bought, as well as just investing in technology. So there's a real important prioritization, I think, when it comes to the use of our capital. But there's no doubt that AI is one of the ways we can become more efficient and productive as an NHS. And so I think we would definitely encourage it. We just need to be able to balance it against the resources we have. Councillor Hill, I think you're next on the list. So do you want to ask your question, please?
Hi there. Sorry, I've sort of got two questions, apologies. But the first one being, so I'm on the Health Overview and Scrutiny Committee in Brighton and Hove, and I'm wondering if there's a possibility of bringing this plan to our committee at some point. And then the second question being that obviously you've talked a bit about there being some financial considerations in this plan, and my understanding is there's sort of been a report by Patricia Hewitt which talks about the roles that HOSCs can play in scrutinising some of the financial decisions that NHS ICBs are making, and I'm interested in how we can start to get a good base of knowledge as a HOSC in order to best scrutinise the ICB on this, and how we can work collaboratively together in the current context in relation to financial decisions that you're making.
Right. Okay. Well, thank you for your question. Well, first of all, I can say that with great confidence that it was actually in the previous administration, but the full strategy that when it was developed was presented to your full council, but by the team at the time. Obviously, there's been a change of administration in Brighton, so that was probably predates maybe your own involvement. I think also the engagement with the local authority processes is really important, and so for example, I'm a member of the Health and Wellbeing Board in Brighton and Hove, and also the other two local authorities. And Adam Doyle, the Chief Executive, is also going to become a regular attendee at the HOSC meetings in each of the three councils. But Adam, would you like to just make a comment about the role of HOSCs and how we can make sure that the scrutiny happens?
Yeah, sure. So there's probably three things I'd say briefly in response to that. So first of all, our plan that we talk about is the NHS element of improving lives together. But actually our governance is the actual 4 statutory organisations that have signed that plan off are Brighton Hove City Council, East Sussex County Council, West Sussex County Council and NHS Sussex. So we see the 4 integrated teams in Brighton and Hove as something that we have co-developed with you and with your population, and also with the public health teams locally. So it feels a co-agreed plan. It also feels very much in line with the new government's direction of travel. So therefore we would be expecting to therefore get that piece right. In terms of the health, so we would say that overseeing our plan and scrutinising our joint plan would probably sit more within the remits of Health and Wellbeing Board, because we need to actually kind of scrutinise each other a bit about what we're all doing to make the plan happen. HOSC, however, I think is a really valuable and local democratic remit, I think, to hold NHS Sussex to account for what it is doing for the NHS services going forward. So I'm very happy to meet offline to go through what are the things that you're most concerned about, that you want to hear from us on, and we would expect to come to HOSC to answer for where things aren't where they need to be and what we're doing to improve that. And we tend to operate all of our HOSCs in East Sussex, West Sussex and Brighton Hove in that way. So very happy to meet offline about how we get the best out of that forum, but also very happy to come and answer questions about what we're doing going forward.
Yeah, and I think just adding to that, Adam, of course, the strategy itself was approved by the Sussex Health and Care Assembly, of which Brighton and Hove City Council is one of the 4 statutory members. So your council has been fully involved in that, but hopefully that gives some helpful context for you. Okay, I think Councillor Belsey, we meet again, I see.
Yeah, hi Stephen.
Hello.
Hi Adam. I'm sorry, I've just had to take a call outside, and I just wondered, somebody may have mentioned it. Two quick points. One is your views on the possibility of Eastbourne not having the investment in it for the future as a new renovated hospital. And the second one is that I heard on the news today that kids playing games and on phones is seriously affecting the eyesight of children. I wonder if you guys are already looking at this or what, because this could become quite an expensive job in the future if things aren't done. And should we be looking at educating before rather than, you know?
Yeah, that's an interesting comment. Maybe I'll bring Hannah in a moment just to talk about the Eastbourne comment in particular. But I think you raised two quite important issues. Obviously, there is a review going on as far as what was the new hospital programme. But Hannah, do you want to just help with just providing what your latest understanding of what the situation is as far as capital investment in terms of new hospitals, and thinking of Eastbourne in particular?
Yeah, thank you very much, Stephen, and hi, Councillor. All we know at the moment is really about that the government is doing a review of the overall programme, and the government quite rightly has prioritised those schemes, the RAC schemes, the reinforced concrete schemes. So those ones have been put forward, and the government is reviewing all the rest of the schemes. I'll put in the chat around the sort of the delivery timescales, the models, and actually taking into account the future demand and needs of the population as well, and also of course the out of hospital provision, which is clearly a key part of our strategy. So how all of that comes together. So we know that the new hospitals programme have been doing that review, and we're working closely with them, so they know what they're fully involved in our programme. But as yet, there's nothing else that has come out on any timescales on that.
Yeah. But obviously, we would want to support our local trusts to gain more capital investment where we can, and so I want to assure you that it's out of our control in terms of that particular process. But obviously, we'll play our part. If the government chooses to prioritise that within the immediate future. I think the eye question is also quite interesting actually, and it's something just thinking about the best person to maybe answer that, but maybe Alison Cannon actually, our Chief Nursing Officer. I think just thinking around some of the needs of our broader population, in terms of thinking about how we can be more preventative, if you like, in our approach, for young people in particular. I just wondered if you had any perspective on that.
Thank you. Thank you for the question, Councillor. I haven't seen the news article today, so I will go back at that and look at interest with that. But being a mother to 4 children, I can absolutely recognise the amount of screen time that our young people are having. And I think we've noticed that through the COVID pandemic, there would obviously have been an increase in that as well. I think for me, just as I'm talking today, there are a couple of things that I would think we would want to work very closely with schools, our public health colleagues, just around some of the education and information and messaging that we can give to children, young people and parents about the damages of long-term screen use can have on our young people. Obviously, we do know that there are, for children under the age of 16, there are eye tests that are available. So we would also want to encourage those, and we would encourage families and schools to recognise where young people may be struggling to see, read, write, etc., and take the corrective action around that. But I think it is a broader society problem, isn't it, around screen usage, both in terms of eyes, but also the amount of time that our young people do spend attached to those devices.
Thank you. I think that's probably we can answer your question there, but thanks to the question. I'm not sure the next individual is Smith Community is what it says on my screen, but I'm not quite sure if I've got your name correct.
No, it is not. It's the funny.
It is a dodgy name because it's Mel Smith.
Oh, hello, Mel.
For a gag, and I do have a friend called Gordon Ramsay.
Ah.
And Laura knows this story, and it is true, and it's not Mel farting around. One thing, I've got a bit of good news for you.
Thank you.
Well, it's the aims and goals and everything I've heard the ICS talk about before I raised a hand for a voluntary position are really truly being achieved. And the working together of different healthcares getting together and working in a conjoined fashion, and so it's much smoother, that is occurring. And that is being significantly noticed by patients, no matter from which realm of health they're coming. And it's something that my question is actually, are you giving yourselves enough of a pat on the back up, or are you getting recognition from yourselves? Because knowing from yourself, yes, we are doing it all right, it is going well, then that is of importance, because you've got, Alison wrote in there in the question in the chat and the answer, and this is exactly where I get all my information from, is from patient experience.
Yep.
And I tell them a marvelous lie and say, right, to me, what you're going to be, all the women are Gina Lola Brigida and all the men are Bob Marley. You don't have to give me your name, but then you can say exactly the truth.
Yeah.
And know that I'm not going to turn around and go and name you and shame you. And it really has reached marks. And just so you know, as a team, the ICS really have, or the ICB, or whichever one we want to be today, have all really got great notice. And you're experts by experience.
Yeah.
The interest just grows and grows. So you should get recognition that you are being noticed, and it is being appreciated.
Well, thank you, Mel. I've just realised you're one of our community ambassadors, of course. So now I can see your full job title on the on the screen. Look, I think we're not complacent about where we are. We know many people are telling us that they need more access to our services. So we're always quite crucial of that. However, we do take our desire to involve and engage local communities and the people that we serve really seriously, and I think we go above and beyond that. So to get that feedback is really gratefully accepted, and it's really appreciated. Yeah, and we don't just do it with community ambassadors. We've got our people, our digital boards. We've got our research, patient and experience people. So there's a number of different fora that we engage in, and that's how we want to make our services better. So, but I don't think the job's done yet, which is maybe why we may be a little bit too reticent in terms of congratulating ourselves. But it's much more powerful coming from you. So
congratulating you and saying thank you, guys.
Thank you very much, Mel.
Thank you.
I appreciate the comment very much. And Chowdhury, I suspect you might have I can't see your full email address either, but you might be a community ambassador too, are you?
Indeed. Don't worry about that. My name is Sunny Chowdhury. There is some concern. I read a bit of your report, annual report last year, a new report. However, the concern is raised by the community and the service user. What their concern is the performance and the service delivery by the, I'm from Brighton, by the way. It's deteriorating. If you want me to, I can give you some example as well. However, that's one thing. The second thing is how we're going to improve the waiting list to be reduced, and also the service delivery to be improved. Because I know the current government is saying, Mr. Streeting is saying that that they're going to fund the NHS, provided it's a performance related, other ways they're not going to. As I understand from your colleagues' financial report, that there is a huge deficit. So how are we going to improve the service delivery? That's one thing. And the second thing is, what are we doing in terms of reducing the waiting list? Thank you.
Yeah. Okay. Well, two very good questions. Can I just check? Are you talking about the Royal Sussex County Hospital, or are you talking primary care, mental health, or all three?
I'm talking about all three.
Yeah, okay. So Claudia Griffiths, our Chief Delivery and Strategy Officer. I might just bring Claudia in for a moment, if that's possible, just to explain, because we were talking only today about our how we're going to reduce our planned care waiting lists in particular. But Claudia, just want to give just a brief comment in terms of what we're doing around improving waiting lists and improving our services within the financial envelope that we've got.
Absolutely. Thank you very much, Stephen, and thank you for the question, Mr. Chowdhury. So yes, there is a huge amount of work going on at the moment focused on waiting lists and how we reduce the waiting times in Sussex. We recognise that too many people are waiting too long for treatment, and we are an outlier in that respect as a system. So over the past 6 to 12 months, a huge amount of work has been done across our providers to look at how we rapidly bring those waiting times down. The most critical of which has been the setting up of an elective coordination centre, which enables us to look at the waiting times of patients across the system and find alternative capacity through which to treat them. So we've moved over 5,000 patients off the waiting lists at the University Hospital Sussex out into either independent sector capacity or across to NHS providers. And that is all centrally funded, so all of that capacity is less, so we're able to utilise as much of that capacity as possible. So we're aiming to give patients choice through that process, but over 90% of the people that have been contacted have accepted alternative providers for treatment. And as I say, we've moved significant volume. So that is very much an ongoing process, and will continue as we work to drive down those waiting times, looking at how we normalise access times across the system as a whole. So we recognise where we need to be yet. The waiting list overall is coming down in Sussex. We're managing to treat more people than are being referred onto the list. We recognise there's still more to do around those long waiters, but there is an absolute critical focus on this with oversight on a weekly and daily more weekly.
Okay, thank you, Claudia. Appreciate that. So I think it's very, very current. It's very important to us, Sonny. So I think we're working our way through that. And as I said earlier, we covered this at our board meeting earlier today. In fact, quite specifically in terms of the progress that we've made, and we've got a clear plan of how we're going to reduce the waiting lists and improve the services. So it's very much work in progress. But thank you for your question. I appreciate that. Aggie, one of our dentists. So, nice
Hello.
to see you again, Aggie.
It's nice to see you. Thanks so much for for sending out this invitation to allow us to be here. But also, just echoing your previous lady, Miss Smith, I just want to say thank you for your engagement. And for reaching out to the profession, because that is actually really new for us in dentistry, and it is really, really appreciated. And also thank you for being brave enough to innovate, for identifying a priority, then actually doing something, not letting the status quo just go on and on, but being brave enough to try something to tackle the priority that you've identified. So that's really, really it doesn't happen everywhere, and it does make a difference. And I'm really pleased to see that. My two questions really were, how might we integrate for better oral health for our population? And then, I don't know, maybe this is related too, but how can we keep our workforce? In dentistry, we've got really good people in dentistry, and when you hear about people leaving, I'd like to keep them, and I'm sure you would too.
We absolutely do want to keep them. So in terms of integrating dental care, maybe I can bring Amy back into the conversation on that, and I'll maybe ask Mark Smith just to comment about how we can keep our people, because there's a whole range of things that we're doing in those two areas. But Amy, why don't I come to you first? You're on mute, Amy. Oh, sorry.
For your comments. It's been a pleasure to work with our community.
I'm sorry, Amy. We can't quite hear you properly. I think the line is cutting in and out, certainly on my laptop. Aggie, could you hear that, or was it just my laptop that was a problem? No. Okay. Could you maybe go onto your laptop and whoever's microphone you were using, try yours?
Can you hear me now?
Yes.
Perfect, thank you. First of all, Aggie, thank you very much.
Well, we do have an echo, actually. Sorry, Amy, to be a new speaker. I can hear Mark.
Can you hear me okay now?
Yeah, go for it.
Okay. Aggie, first of all, thank you so much for your comments in relation to how we've been working with the profession. It's been a pleasure for me to be able to take ideas and implement them into practice. In terms of oral health, we were just discussing this actually today at our board meeting because we did do a bit of an overview of our dental plan across Sussex. And oral health is fundamentally important, and we do need to do better at linking in with our schools in order to make sure that we are really educating our children, but also the wider population in terms of good oral hygiene, because that would then help us deal with a different type of demand to probably the one that we're experiencing at the moment. So we are working with our public health colleagues in the 3 local authority areas on this, but absolutely there is more work that we need to do to improve education and also understand oral health across Sussex, and that's part of our overall Sussex Dental Recovery Plan.
Great, well, thank you, Amy. And before I bring Mark in, just to sort of make a comment around oral health is part of our population outcomes framework, because we also recognise there's some distinct inequalities in both dental access and also oral care. So trying to make sure we support our most deprived communities is really important as part of that. I'm just conscious of time, but I would like to ask just to bring Mark Smith in, our Chief People Officer, just to talk about how we can retain people, not just dentists, but our entire NHS workforce.
Thank you, Stephen, and thank you, Aggie, for the question in terms of retention. So it's a huge area that we've been focusing on as part of our people plan that Adam referenced earlier, in terms of how do we recruit, how do we educate, and how do we retain our colleagues. And the clue really is in that education piece. So one of our biggest elements of retention is the strength that we have with regards to development for careers and providing opportunities across the health service. And that's one of the areas that we're really trying to focus on with our education authorities in terms of how can we enhance and give people further skills and development in an MDT approach and in the settings in which they work. So there's a real focus of our attention, as I say, in the plan, and we are looking, and we have been seeing, again, it was in our board reports, in our integrated performance report today, that we are seeing a reduction, thankfully, in the number of colleagues that are leaving us from the health service to move to other areas, and long may that continue with some of the interventions that we're putting in place.
Great, thank you, Mark. Appreciate that, and thank you for your question, and thank you for your continued engagement, Aggie, in the various fora that you're involved. We do appreciate that as well. So I'm just conscious it's 1 minute past 5, so I think I do like to try and finish meetings on time. So we're 1 minute late starting, so maybe 1 minute late finishing is also okay, I hope. I think we've heard today about what I think has been a good year for the NHS in Sussex in terms of 23-24. A huge amount has been achieved, but there's still more to do. I think that's quite clear. And so just to reiterate Adam's thanks to the 43,000 staff that work across the NHS in Sussex. We're genuinely trying to do the very best we can with the resources we have to support and improve the health of the 1.7 million people who live in Sussex. Thank you for taking the time for joining us on our AGM today. We do appreciate that, and also for your questions. We'll publish the transcript for this meeting and the questions and answers and also the video on our website. We're also going to continue to engage at every opportunity with, and it was so nice to hear the feedback from Mel around the community ambassadors and the lived experience networks, but all the other fora that we use as well. We take our responsibilities to engaging with the public really importantly, and we'll continue to do that. And just to finalise that, I think what's really gives me hope and encouragement for the future of the NHS in Sussex is the fact that we have a plan that has been agreed across the NHS organisations and all the key organisations, and that includes primary care as well as the major hospital trusts and NHS Sussex Integrated Care Board, as well as our local authorities, our voluntary sector, and we haven't talked about the Hospice Alliance today, but they're also important partners in everything that we do. So again, the fact we have a plan, we're really clear about how we want to move care at or close to home through our integrated community teams. You saw the story of what that could look like in practice through the example with Jen on the video that we saw earlier. And then finally, you know, I think we want to continue to develop our workforce because they're the lifeblood of our organisation, and we'll continue to invest in the digital technology and data, using AI where we can and using the resources that we've got as wisely as we can. All of this is geared about improving lives together. That's our plan for the future, and we'll continue to talk about that on other occasions. So thank you for your time today. If you've got any further questions, then please get in touch through our website. There's a contact us page there, and certainly look forward to meeting you at the next engagement opportunity. So thanks for your support today, and see you all again soon. Bye-bye for now.